Hello everyone! So for today's video, I will be performing the musculoskeletal and neurologic as well as the peripheral vascular assessment, which includes the neurovascular system. Before I start the procedure, I must identify the patient, explain the purpose of the musculoskeletal and neurologic as well as the peripheral vascular assessment, which includes the neurovascular system. Next is instruct the patient to void if possible and collect a urine specimen if ordered. Lastly, perform hand hygiene. In assessing the neurovascular system, we should assess the patient's mental status. First is evaluate the patient's orientation to person, place, and time. What is your name?
My name is Anna Maria.
Do you know what is this place?
Yes, this is hospital.
What time is it?
4:30.
Second is evaluate the level of consciousness. For example, hello Miss Royan.
Hello, nurse.
Next is assess memory, immediate recall and past memory.
Oh.
Can you tell me your name?
My name is Anna Maria.
What time is it?
It's already 4:30.
What month is it?
March.
And lastly, can you please raise your hand for me? The right. Okay. And for the last, patient's mental status is assess abstract reasoning by asking the patient to explain a proverb, such as birds with the same feathers flock together. Can you explain that proverb to me?
People with the same sort or with the same taste and interest will be found together.
And the second one for the neurovascular, in assessing the neurovascular system is test for cranial nerve functions, such as ask the patient to close the eyes, occlude one nostrils, and then identify the smell of different substances such as a coffee, chocolate, or alcohol. Repeat with the other nostrils. Can you close your eyes, please, and cover the right nostril? And try to guess the smell. Alcohol. Okay. Next is cover the left nostril and try to guess the smell.
Bingka.
Next is test for visual acuity and pupillary constriction. So over here we have a Snellen chart, and I will use this to test my patient's visual acuity and pupillary constriction. I'm going to point a letter and try to guess what it is. Okay? F P O F T D D. Next is move the patient's eyes through the cardinal position of gaze. Follow my finger, please. Okay. After that, we should ask the patient to smile, frown, wrinkle forehead, and puff out cheeks. Can you smile for me? Frown, wrinkle forehead, and puff out cheeks. Next is test hearing. Can you hear it clearly? After testing the hearing, the next thing is test the gag reflex by touching the posterior pharynx with a tongue depressor. Explain to patient that this may be uncomfortable. This may be uncomfortable, okay? And lastly, for the test for cranial nerve function is place your hands on the patient's shoulders while she shrugs against the resistance. Then place your hand on the patient's left cheek, then right cheek, and have the patient push against it. Shrug your shoulder. Again. Again. The third step in assessing the neurovascular system is inspect the ability of the patient to move her neck. Ask the patient to touch her chin to chest and to each shoulder, each ear to the corresponding shoulder, and then tip head back as far as possible. Okay. Next is inspect the upper extremities. Observe for skin color, presence of lesion, rashes, and muscle mass. Palpate for presence of lesions, rashes, and presence of masses. Next is ask the patient to extend arms forward and then rapidly turn palms up and down. Okay, good. Next is ask the patient to flex upper arm and to resist examiner's opposing face. Next is inspect and palpate the hands, fingers, wrist, and elbow. Palpate the radial and brachial pulses.
Tayo up na ini.
Next is have the patient squeeze two of your fingers. Squeeze. Okay. Next is ask the patient to close her eyes. Place a familiar objects such as key in the different hand and ask her to identify the objects. Repeat on the other hand with a different object. Can you please close your eyes open? Yes, what is this?
Lip tint.
Can we guess what this is?
Ball pen.
Okay, thank you. Next, ask the patient to close her eyes. Using your finger or applicator, trace a one-digit number on the patient's palm and ask her to identify the number. Repeat on the other hand with a different number. Palm.
7. 2.
Okay. Next, assist the patient to a supine position. Examine the lower extremities. Inspect the legs and the feet for color, lesion, varicosities, hair growth, nail growth, edema, and muscle mass. Next, test for pitting edema in the pretibial area by pressing fingers into the skin of pretibial area. If an indentation remains in the skin after the fingers have been lifted, pitting edema is present. So as you can see, there is no indentation remains, which means that the patient doesn't have a pitting edema. Then, palpate for pulse and skin temperature at the posterior tibial, dorsalis pedis, and popliteal areas. Have the patient perform the straight leg test with one leg at a time. Can you straight the down? Next, ask the patient to move one leg laterally with the knee straight to test abduction and medially to test adduction of the hips. Thank you. Next is ask the patient to raise the thigh against the resistance of your hands. Next, have the patient push outward against the resistance of your hands. Then have the patient pull backward against the resistance of your hand. Repeat on the opposite side. The 8th step for assessing the neurovascular system is assess the patient deep tendon reflex. First is place your fingers above the patient's wrist and tap with reflex hammer. Repeat on the other arm. Place your fingers over the antecubital area and tap with a reflex hammer. Repeat on the other side. Next, place your finger over with the tricep tendon area and tap with a reflex hammer. Repeat on the other side. Next is tap just below the patella with a reflex hammer. Repeat on the other side. Next, tap over the Achilles tendon area with reflex hammer. Repeat on the other side. Stroke the sole of the patient's foot with the end of a reflex hammer, handle or other hard object such as key. Repeat on the other side. Ask the patient to dorsiflex and then plantarflex both feet against the opposing resistance. Next, as needed, assist the patient to a standing position. Observe the patient as she walks with a regular gait on the toes on the heels, and then heel to toe. And the last step in assessing the neurovascular system is perform the Ruberge test. Ask the patient to stand straight with feet together, both eyes closed with arms at side. Wait for 20 seconds and observe for patient swaying and ability to maintain balance. Nurse must be alert to prevent fall or injury related to losing balance during this assessment.
13, 14, 15, 16, 17, 18, 19, 20.
After doing all the procedures, assist the patient to a comfortable position. Perform hand hygiene, and then lastly, document the findings of these assessments. That will be all for this assessment. I hope you learned something. Thank you so much for watching.